Hi, my name is Jim Mullen. I'm with Blood Monitoring Solutions. In 1818, the first human-to-human transfusion was performed. In 1918, refrigeration proved as a means for preserving blood. This made hospital transfusions a viable procedure. Today, up to 40 units can be transfused to a single trauma patient. Likewise, a single unit can sustain an infant's life for up to 2 weeks. Blood saves lives. And this is why in the United States, each year, 15 million units are donated. And each one of those units requires thorough documentation. Each time a unit is issued for transfusion, the blood bank technician has to record a series of data, including the time, the unit number, and the destination. Blood bank technicians really do care about each unit. However, when the blood leaves the blood bank, clinical staff focus is directed elsewhere. And as a result, over $100 million in blood is wasted each year. It shouldn't be like that. Blood Monitoring Solutions has created a system for tracking and monitoring the blood. Now, blood bank technicians can control the blood long after it has left the blood bank. Our system uses sensors, scanners, and an intelligent IT infrastructure to track and monitor that blood. Using our system, the blood bank technician will scan the unit and scan the cooler. That will then activate an ambient air temperature sensor inside that cooler. And as the temperature rises, alerts will notify the users so that they have the opportunity to save that blood before it has to be discarded. Electronically storing that data allows them to analyze the entire process for improvements and for refinement. Additionally, we provide the reports that blood bank management use to benchmark their performance from one month to the next. We offer 3 key benefits. The first is efficiency. By automating this process, we reduce the time and the error that are associated with manual data logging. Next, we offer savings. We provide the alerts so that the blood banks can save the blood before it has to be wasted. And lastly, we provide intelligence. We give the blood banks business intelligence that they have never been before provided. So while the blood is inside the blood bank, there's a significant amount of effort that goes into tracking and monitoring each unit. However, when the blood leaves the blood bank, this all breaks down. Currently, there are 3 products that are used mainly for tracking the blood, or for blood in transport within hospitals. However, none of these systems are able to track and monitor from blood bank all the way to transfusion, sending reports and sending alerts. We'll be a Class 1 510K exempt device, and we will be subject to GMP, to good manufacturing practices. And because we do use medical data, we will be HIPAA compliant. And we will be sold into the operating budget within the blood banks. We're going to initialize in the market by selling paid trials to large academic institutes. The reason for this is that they have the highest transfusion volume, and therefore they waste the most blood. We're going to ask them to record studies around the effectiveness of our product regarding both the time and the wastage that we're able to save. We're then going to publish those studies in journals, and we're going to present them at conferences to reach a broader base of blood banks. With that broader base, we're going to be offering paid trials, which will then convert into purchase orders. So our average customer will have about 20,000 transfusions per year and will waste about $140,000 in blood. And to reach those customers, our system will charge around $4,700 for the implementation and around $3,300 in the monthly subscription cost. And this will then scale out into a United States market potential of around $34 million per year between the implementation and the subscription. and we have a great team to attack that market. I have a mechanical engineering degree from Vanderbilt University, and I've worked in controls automation. Chris Baker has worked in the Vanderbilt Blood Bank for 2 years, and he has a biomedical engineering degree from Vanderbilt. Additionally, we work with Dr. Garrett Booth. He's the director of the Vanderbilt Blood Bank, and he serves on the Tennessee Association of Blood Banks Board of Directors. We also work with Tom Rame, founder and CEO of Big River Manufacturing, a local medical device manufacturer. So to this point, we've created an initial hardware prototype, and we've gotten a provisional patent based around that hardware. However, since getting money from the ZeroTo510 program, we've done significant customer research, and we've recognized that the real value in our product is around the data and the process that we're able to provide. And so we've created a second generation product and a second provisional patent based on that software and based on that process. Going forward, we're looking for $1.5 million. And with that, we're going to create a beta software which we'll implement in hospitals by January of 2015. We're then going to convert our provisional patent into a full utility patent, and we're going to create a HIPAA-compliant software, register with the FDA, and have our product onto market by August of 2015. Blood saves lives, and blood should not be wasted. And with our system, blood will not be wasted. I invite each of you to join us as we reduce the cost for hospitals by increasing efficiency and decreasing their wastage. Thank you.